said that through CPS, the parental substance abuse was a contributing factor in 68% of the children being removed in Texas. So we know that substance abuse is a huge problem with the families that we serve. It doesn't always result in abuse, but 94% of the time it results in neglectful supervision. So our parents are struggling with this substance abuse problem. They love their children. They want to be able to have their children live with them safely, but recovery is so difficult. So today we're going to hear from Daniel Barrientos about the Billy T Cattan program and what services that they provide for our parents and our families, and ways that we can support our families to successfully work their way through these programs. So welcome, Daniel. Thank you so much.
Thank you, Diana. I really appreciate that. And I'm glad to be here with y'all today and kind of paint a picture for everybody on what services we provide, and also some of the drugs that are being abused and used here in Victoria. Please, if you have any questions anywhere throughout my presentation, please feel free to ask. I'm pretty open about answering questions at any point. But my name is Daniel Barrientos, and I am the Executive Director here at Billy T Cattan Recovery Outreach. And I've been here at the organization since 2014. So the time has really flown by. Before that, I was at Midcoast Family Services for 17 years, and served in a lot of different capacities there. But found my passion was to help those that were struggling with substance abuse issues. So I came here, and a lot has changed since I've come. So there's a lot of different programs that we've started, and kind of just changed the way the program was done before. So I'll be sharing some of those things with you, and like I said, just have any questions, just please let me know. I'm glad to be a partner in the community with CASA. Tim and I talk regularly when we see each other, not as much anymore because we don't see each other in person as much, but we definitely have always had a good relationship, working relationship. So I'm happy to be here to share that information with y'all. I'm going to try to share my screen here. Hopefully it works. I do have a PowerPoint just so I can make sure I hit all the things I want to talk about today. So let me try that real quick. And okay, everybody can see the screen?
Yes.
Okay. All right. So this is just basically our contact information. Our website is listed on this page as well. In 2017, we moved to our Crestwood location. We did a small little capital campaign, and we're able to get some donors to purchase our own building over here at 802 East Crestwood. It was a big step for us. With addiction, it's very important for us to have a private facility, where before we were in a public area, and some of our clients sometimes didn't feel as comfortable coming because of that reason. So the board and myself made it a mission that in 3 years we would hopefully find a location, and that we can call home. And so this building that used to be the old, actually it used to be the Victoria College's building before we took it over, but before that it was a CPNL building here in Victoria, the Central Power and Light. And it was just a really good fit for us, and has worked out really well. So this is where we're at. This is our mission. The mission, I'll read it out loud, but the mission of Billy T Cattan Recovery Outreach is to rebuild lives impacted by alcohol and drug addiction through 12-step principles and evidence-based treatment, restoring health, hope, spirituality, and relationships. So in our program, we strongly believe in the 12 steps of AA, and we incorporate those steps into our curriculum. That's our treatment curriculum. So they're interwoven in the curriculum that we use. Of course, we are a nonprofit. We're a faith-based organization. Like I said, we're spiritual in the sense that we follow the 12 steps of AA, and provide that in our curriculum, like I mentioned earlier. We do substance use treatment, but here recently we also started treating co-occurring disorders. And so a co-occurring disorder is somebody who comes in that also has a mental health concern, coupled with their substance use disorder. So that's a big step in the community to be able to provide that resource. Before we would have to, refer out for our clients that did have a co-occurring disorder, and now we're able to treat that disorder here in our facility. So we're real happy that to be able to do that. But Billy T Cattan Recovery Outreach was started in November of 1999, and it's named after Billy Ty Cattan. He was a gentleman here in Victoria that was, pretty well known during that time, and himself had issues with substances, and was able to get treatment and get help, and became clean and sober. But shortly after that, he developed cancer and passed away. And so his widow, which Susan Cattan Rebuck, I should say, started the organization with some other community members back in '99. It was a pretty small organization, a one-person organization. Some people may remember Dan Jazario. He was the executive director, but also the counselor, and provided just mainly counseling. It wasn't a formal treatment program back in its early days, but it was around to provide free counseling, spiritual counseling to anybody who needed help with addiction. And so from that, we've kind of developed into the organization that we are now, adding the different programs that we do. So I'll talk about those more specifically here in a little bit. This is our staff. Of course, I'm the executive director, but Elma Sines is our clinical coordinator, and she pretty much handles all of our treatment aspects of our program. Anything clinical, Elma's doing, so we're glad to have her. We have Esther, who's our office manager. We have an administrative assistant, and then we have the counselors that you see down below that. Each one of them is a licensed chemical dependency counselor or a licensed professional counselor intern that are really close to getting their licensure. We do have some new people that we've added here recently, 3 staff that we added recently. With the funding that we received through the state, we were able to hire some more staff, so which was a really good thing for us to do as well. So as you can see, when I started, I think we were 5, and we've kind of grown to the staff that we are now. And as Tim mentioned earlier, Stephanie Baxi, who did work for CASA, is part of our team now as well. And she's a licensed chemical dependency counselor intern. So we'll be training her and getting her ready to start seeing clients. This is an old picture. This is our staff of last year. So there was 5 of us there. I'm sorry, 6 of us there. And like I said, we've added a few more since then. So we'll be taking a new picture here pretty soon. Outpatient treatment. So what is outpatient treatment? We combined, like I said earlier, the 12 steps of AA with group educational and psychotherapies. We integrate the family, relapse prevention, and individual clinical sessions. Our educational sessions focus on very specific underlying issues, anywhere from life skills to helping them with financial planning, and of course the addiction treatment topics as well. Each individual's treatment is tailored to promote long-lasting recovery. So everybody's treatment plan is different. Because everybody comes in with different needs. And so it's individualized treatment. The typical length of stay is 90 days in outpatient. We do have some contracts where our clients stay a little longer. And like I said, we'll touch on those here in just a little bit. But the typical length of stay is 90 days. We utilize evidence-based treatment, and we treat the whole person. Our curriculum is evidence-based. It's approved by the federal government and has shown to prove results. That's something that, because we are state funded, we have to use curriculum that is approved by the federal government. And like I said earlier, our program is customized to each patient's care and or needs, I should say. Our sessions are done in the morning and in the evenings, and they can find a time that works for them. We do have a lot of people who work and who have other obligations, and so we try to be as flexible as we can with our schedule. Most of our individual sessions are done during the day, and our group activities are done in the evening, Monday through Thursday. So our office is closed on Friday. And then, of course, we provide treatment for co-occurring addiction I talked about earlier, which is anxiety to depression and other mental health concerns. And we create an aftercare program for once they leave our services, because 90 days is not a lot of time. So we have to come up with ways for them to carry on that recovery with them once they leave us. So, and just on a little side note, we have been providing our services all virtually since the end of March, via telephone and via other virtual platforms. But starting November 1st, we're actually going back to face-to-face with some of our programs. So we've been busy trying to come up with ways to make sure that we're going to be as safe as possible here at the office. These are some of the other services that we offer here at the agency. First of all, we're the only state-funded organization, substance abuse organization, in a 120-mile radius. So from here to Corpus, Corpus would probably be the next closest place. Health and Human Services Commission does fund our indigent program, and so, but we do have a lot of other funding sources. So, like I said, I'll talk about those here in just a little bit. Our program is for adults, 18 years or older, male or female, who are seeking treatment for substance abuse, but do not necessarily need detox. If somebody needs detox, then we're going to refer them out first to detox services, which are typically going to be done in Corpus, San Antonio, Houston. Once they complete detox can be anywhere from 3 to 7 days. Once they get done with detox, then either they have the option to go to inpatient treatment or residential treatment, and when they get done there, they come back to us for outpatient. So that's typically the way it works. Like I said, the typical length of stay is 90 days. It includes 8 individual clinical sessions and then 12 group sessions. Our group sessions are 2 hours long apiece. And so that's the way the program works. The COPS-D program was what we call the co-occurring psychiatric and substance use disorder program. And that provides additional services for those, like I mentioned earlier, that are dealing with anxiety or major depression, schizophrenia, any of those disorders in the mental health side. And so we provide some case management, but at the same time, we're treating both. So we're treating the mental aspect and the substance abuse side, because a lot of the times it's always like, what do we treat first? Do we treat the substance abuse part first, or do we treat the mental health side? Because they can both, go against each other. And so now we're able to treat both. So they're in treatment during the same time for both disorders. We also have a alumni 12-step group, which is a very beneficial part of our program. So anybody who has either been a client of ours in the past or is currently a client is encouraged to attend our alumni program. It's all peer driven, which is awesome, because they come because they want to, and they find support amongst each other in the groups. We also provide substance abuse professional services for employees who have violated the transportation, the TOT regulation for drug and alcohol offenses. So if somebody is, I believe we're the only entity in town that does that, but so if anybody has a dirty urine analysis at work, or they get DWI or anything like that, their employer will refer them to us to do an assessment. And then of course they have to follow the recommendations of that assessment. It is a mandated thing that they have to do. We also offer their DWI intervention program for repeat offenders. So this program is 15 weeks long, and it's for anybody who has multiple DWIs. A lot of the times, the people who come from that come to that program are going to be mandated by the courts as well. We also offer intervention services, professional intervention services. So we do family consultations and education. We help them with the intervention, and then we give them some of the treatment options and kind of walk them through that process. That's something that we do quite frequently when somebody calls. And this is something new here that we're going to start probably within the next few weeks. Is some recovery support services, and this is going to be possible through some funding through Texas A&M. And so we've developed a partnership with them. They've written a grant to be able to help fund that. So what we're going to be doing with that program is we are going to offer a training to some of our alumni and other individuals who have been in recovery for at least a year or more, and they'll actually get a 40-hour training that will they'll be able to become certified, and then be able to help those that are in early recovery or in treatment, kind of walk them through the steps and help them, have somebody to talk to outside of the clinical side of it. So peer-to-peer stuff has shown to work very effectively, and so that's one piece that we wanted to add to our services, and thankfully we'll be able to be doing that here pretty soon. We also offer a nicotine replacement therapy to all of our clients. A couple of years ago, we partnered with the University of Houston, downtown in Houston, and another organization called Integral Care. Because substance abuse clients have a rate of 2 to 4 times higher for using tobacco products, there was a grant out there that we were able to apply for and receive that gives free nicotine products to clients in treatment centers. And so we've been able to offer nicotine patches, gum, and lozenges to all of our clients who have a tobacco use disorder. And of course, that's identified when we do our assessments with our clients, and that's been very successful. And we've given away a lot of products, so we're really, really happy to have that as a part of our treatment services as well. The first 6 months of the implementation, we had an 88% smoke quit attempt rate, which was a very good results there, and actually had a journal article written about the program because of its success. So we're like I said, happy to be able to do that. So here are our contracts and funding. We have a contract with Health and Human Services Commission to provide treatment for adults and outpatient treatment, and then that funding is for anyone who meets financial eligibility, that either they don't have the means to pay for treatment, or they don't have insurance, they're indigent. So that's a big part of our funding there that helps a lot of people. So before I came here, we did not have that funding, and so prior to that, 85% of the clients that would come here were either mandated by probation, parole, or the courts. And so when we received that funding in 2015, about a year after I got here, that kind of opened the doors for other people to start receiving services that weren't able to pay for services. So we're very, very fortunate to have that contract. That contract also pays for the co-occurring disorders treatment as well. So so that's how that program works. We also accept insurance. So for those who are not indigent and have insurance and or make above the state guidelines for financial eligibility, we accept major insurances, and also do private pay. If anybody doesn't want to use their insurance, they have private pay. We are a Medicaid center, so we do also accept Medicaid. Our other contract that we've had, and we've had this one for a lot of years before I was here, is the Texas Department of Criminal Justice. So that's a TDCJ contract, and those patients or clients do come from the prison system. Some of them, there's a lot of, it's kind of complicated, so I won't go through all the different ways, but basically the two different ways is that there are some that are early released from prison because they have drug offenses, and part of their early release agreement is that they would have to attend treatment. And so they have to attend treatment for 9 months. So they're here for a long time. And we have a specific curriculum that we use for them, obviously, that's going to last more than the 3 months. And so they're here for that long. And then we have those that were on parole and they violated their parole for a drug-related offense, and then they come for the 3 months. So that's the way that program works. We also get funding from adult probation here in Victoria that covers the 7 counties. And those, of course, those individuals are also mandated to come as well. And then here recently, we're also receiving the funding from Texas A&M. These are just some of the insurances that we accept. As you can see, Blue Cross Blue Shield is probably our #1 insurance that we accept as far as people coming in with that one, and United Healthcare, Cigna, and Aetna, and then Texas Medicaid. Some of our other funding sources. So it's really important for our organization to have other funding streams because state contracts, they're not reimbursed at 100%. And so they actually reimburse us probably at about 45% of the cost of treatment. And so we have to get creative, just like a lot of the other nonprofits in town, and try to find other funding sources. We are a United Way partner with the Victoria United Way and also the Calhoun County United Way, and have been for a number of years. We do fundraising. Our event is the Dancing with the Stars, which we were not going to do this year, and it worked out really well with all the COVID stuff that we didn't do it, of course. We were going to kind of let it rest for a little bit and do something different. But that is the major fundraiser that we do, is the Dancing with the Stars. And then just other small little things that we get involved in here and there. We get funding from some foundations and other civic organizations, and of course, individual donors and annual campaigns. So how does someone access treatment? So, and this is very good to know, because there's a lot of people who have never, especially those that never use our service, want to find out, well, how do I get treatment? And so the first step, if somebody is indigent, they don't have insurance, or they don't have the means to pay for treatment, the first step is to go through the Outreach, Screen, and Referral Program, which we call the OSAR. That's a state-funded program to help those who are needing state-funded services, detox, residential, or outpatient. And this is the little bit of the confusing part. That program is not under our umbrella. It's under the Center for Healthcare Services in San Antonio, and they do have a counselor that's housed here at our office. And her name is Tammy Hogan, as you see her name there, her contact information, her phone number at least. But she's considered the front door for treatment for those who are needing state-funded treatment. So she does screenings, and they're typically about an hour long, and she collects all the information and makes a diagnosis. And based on her diagnosis, either they come to us or they go to detox or a residential program. So that's how that works. She does have a priority population, because her wait list tends to run a couple of weeks or so, kind of like ours. And you can see down there, the typical wait time is 2 to 3 weeks before an appointment. But we're hoping that we're adding some more counselors, that maybe that wait time will go down. But with her, the way it works, if they do have a priority population, if someone is pregnant and an IV user, pregnant or IV user or DFPS client, they have to be seen within 72 hours. So that's how that works. Now, anybody else, insurance, private pay, they would call us directly, and we would schedule their appointment for them. So if they don't need state-funded services, there's no need for them to go to the OSAR. Common roadblocks to treatment. So the first one is stigma. Stigma is really a big deal for people that are looking to get help. 90% of people who actually need treatment don't make it to treatment. So you can see how stigma stands in the way sometimes. But we see stigma in a lot of different ways. People label it. A lot of people, for a long time, it said that it's a personal problem, that it's a failure, that they should have the willpower to be able to quit. And of course that has been medically proven that it's a disorder. And so a disorder needs treatment. And so, but a lot of the times, even now, as all these times have gone by, all the research that has been done, stigma is still a big factor. And people sometimes are afraid to come to get help because they're afraid of what others are going to think if they're here to get help. So another one is an untreated mental illness. So if they're not being treated for or on a medication for some type of mental health illness, then they're not going to come to treatment. Unrealistic expectations for recovery. People will think that they're going to fail right off the bat. So they just don't come. They're going to say, well, I'm going to go and I'm going to relapse, and if I relapse, I'm a failure and it's not going to work. And so that's not that prevents actually people from getting help. Peer groups and bad relationships. The people that we hang out with. And it starts when we're young, as everybody knows. If you hang out with people who are a bad influence in your life, more than likely you're gonna get into trouble or get into behaviors that you shouldn't be in. So it applies to a lot of our clients, and that's one of the things that we see a lot is that people who do relapse are, they're still hanging out with their peers that they used to hang out with before, still up to drinking and doing those types of things. So that's a big roadblock. And also bad relationships, domestic violence. There's some people who are using because they're in a domestic violence situation to kind of cope with that, or to deal with any kind of relationship that's harmful to them. And then the other one is paying for treatment. Of course, residential treatment, inpatient treatment can be very expensive, especially for private pay private facilities. But the truth of the matter is that there is state-funded treatment, so it shouldn't be a roadblock for anybody, because if you qualify, then the state picks up the cost. So, and then with outpatient treatment, it's very inexpensive. Even if you had to self-pay, it's still fairly inexpensive to get treatment here in Victoria. So this is just a couple of three things that I threw out there. I think one of them I already mentioned, but 1 out of 4 people in the United States knows somebody who has a substance use disorder, alcohol or marijuana or any other drug that's out there. And they estimate that 114 people die a day because of drugs, and accidents, fatal accidents, DWIs, things like that. Or they go, and 6,748 go to emergency hospital rooms, and then 90% of people who need treatment don't receive it, and a lot of that is because of the stigma or the things that we just talked about just a little while ago. So these were our admissions in 2020 so far, and by primary diagnosis. So the number one admission that we see people for here is methamphetamine use. That's a big one down here in Victoria and in the rural areas. That a lot of the opiate use disorder has gotten a lot of attention nationally, but here in our area, anyway, from San Antonio all the way down here, methamphetamine use is the one that we see the most of. Second is alcohol use. Third is marijuana. Fourth, cocaine, and fifth is the opiate use. So, and just because number 5 is opiate use for us doesn't mean that it's not a problem in Victoria. It just means that our admissions don't paint that picture. So we know that opiate use is very, very dangerous because of the overdoses, and with either heroin or prescription drugs. So we still pay a lot of attention to opiate use disorder for the clients that we do have that have that disorder, and we also offer them Narcan. And Narcan is kind of the antidote for somebody who's having an overdose. So any client that has a opiate use disorder that walks through our doors, we're going to talk to them about Narcan and give them Narcan to take to their loved one or someone that they're living with or staying with. So if something like that happens, then we can save a life. 2019 at a glance, we admitted 553 people in 2019. Our average daily census ranges from 130 to 145. All that's been up since COVID. Believe it or not, we've had a lot of our caseloads have increased dramatically, and our show rate has increased because of our telehealth services, and people are able to make their appointments when you're doing them by phone or virtually because they don't have a transportation issue or anything like that. None of those roadblocks are there, so it's been very successful for us to be able to do it that way. But of course, we prefer the face-to-face. It's going to be, in our opinion, the best way to treat disorders. This is the breakdown by counties. 70% of our clients are from Victoria, and then DeWitt's 9, Calhoun is 8, Jackson 6, Lavaca 3, Referral 3, and Goliad 1. So this was of last year. 55% are in the 18 to 34 range, 37 are in the 35 to 54, and 8% are 55 and up. We have more males, 59% are male, 41% are female, 44% are white, 46% Hispanic, and 10% Black. And we do measure outcomes. There's certain outcomes that we measure actually, because we are grant funded in contracts and have contracts. But 40% of our admissions successfully discharged in 2019. And the national average is between 24 and 28. So we're above the average. So we're very proud to be where we're at. We really try to focus on their recovery. So we have some very passionate staff and use some pretty good techniques with them. So. And there's my contact information. So if anybody has any questions, or you can always pick up the phone, call me or email me, and I'll be more than happy to answer any questions that you may have. So I'm done with my presentation. If you have any questions or comments, I'm here to entertain any.
Yeah, I have a couple questions.
Sure.
Do you have a medical director or medical consultant? How do you handle that kind of situation, those kinds of situations? I know you don't, you send them a detox, but do you have medical backup for your system?
We work with Dr. Antai a lot. He's at DTAR.
Okay.
He's the head of residency there. So we work with him, and then we also work with Crossroads Psychiatry. She's an MD as well. Courtney Roberts, Dr. Roberts, and so we use them to whenever there is a question that we have or need help with somebody who does need some medical advice. Okay. But we do have a clinical director as well, and she manages all of our clinical stuff.
And one other question is, do you anticipate you're going to continue doing the telehealth after COVID is, if it's ever over? And I mean, you say it's been successful. Is that just be an extra kind of an outreach that you'll do?
I would love to. So back and I belong to a state association of treatment centers, and so one of the things that we're advocating to the federal government and to the state is for them to keep telehealth options available, at least to some degree, for those individuals who cannot make their appointments because either transportation, we have people that live in Seadrift or, somewhere out where they don't have a way to get here, and they've been able to make their appointments because of that, or it can be a mom who's at home and she can't find a babysitter, and, she can make their appointments virtually. So, and it's not just us, it's across the board. All the treatment centers are seeing the same kind of success with the virtual stuff. But back in March, the federal government, with the president, lacked some of those rules of HIPAA and confidentiality, where we were able to do those services virtually. So we're hoping that we'll be able to do some, going forward.
Good. I have one more question. I'm sorry.
Yes.
You said you provide patches and so forth for your smokers. Had you considered doing some, because I used to do smoking cessation groups, had you considered doing some groups for smoking cessation along with the patches and stuff?
Well, part of our treatment program, so all of the people who receive the nicotine products are also in our treatment program, and
Okay.
so we focus on tobacco education and stuff in our curriculum as well. So we kind of cover that in there.
Okay, thank you. That's all. I'm done. Those are my questions. Those are my questions.
No
Great
problem.
questions, Esther. Anyone else have some questions? Daniel, are there any other organizations nearby that provide the same services that you're all doing?
129.
I believe there's Reclamation Counseling who does drug counseling. I don't know if they have a formal treatment program, but there's nobody around that has state funds. So, and that's the big deal, because then people who are unable to pay for treatment, they don't have to pay for it. So the state will pick up the tab.
Yeah.
So, but no, as far as the comprehensive service that we offer, there's not.
Okay, thank you.
You're welcome.
Anyone else? Well, Daniel, thank you. We normally give you a nice little goodie basket. It's a virtual one here.
Thank you, Tim. I appreciate that.
You're welcome. The next time I see you, I'll get you one. So.
Okay, there you go. That's the deal.
Wonderful. Well, thank you for joining us. Thank you for that information. We have worked with people that do need your services, and we do need more information about that.
Absolutely. If you ever need anything, you know how to find me and where to call. So we're here to help in any way we can.
I promise you we'll use it, and we promise not to be too much of pests about it. But we do like a good resource, and you've just become one of our best resources. Thank you.
Thank you, Tim.
You're welcome. Everyone else,